Hello, my name is Dante, and today we're going to be demonstrating oral care. Okay, skill number 20. All right. Hello, how are you doing, Mr. Jones? My name is Dante, and I'm going to be your CNA today. The reason why I'm here is to perform oral care for you. I just want to brush your teeth so that way, we can get your mouth clean. Okay, that sounds good to you? Wonderful. I'm going to go ahead and wash my hands and get my supplies. I'm going to take a look at your wristband. It is Mr. Jones. At this point, I'm going to go wash my hands, close curtains, state sanitize, or wash his hands, and I'm going to go get my supplies. My supplies are going to be 2 towels. One of them is going to be used for the clothing protector, or you can use a clothing protector style bib. That is also going to be one, but they have like a Velcro goes around the neck, and it looks like a bib, but we call it a clothing protector, right? All right, and then we have my MS's basin, toothbrush, toothpaste, and I have a cup of water that I'm going to be getting or collecting. All right, here we are. I'm back, Mr. Jones. All right, I want to let you know I got my articles. I'm going to place this onto my surface. So I'm going to get my clean surface going. Here we go. Place this onto the tabletop so I can put all my supplies right here as needed. All right, I'm going to go right quick so your bed's still at lowest level. I'm going to go obtain some water. So I've got some water for the patient now. All right, I'm back. All right, so what we're going to do is I'm going to go ahead and get your bed. I'm going to bring it up to waist level. All right, waist level. The other thing is for me to brush your teeth, I can't let you in this position. I'm going to go ahead and bring you up to about 75 to 90 degrees. All right. Now you're up at a nice high Fowler's position. Wonderful. All right, so I'm going to go ahead and bring your table right next to you here. I'm going to go ahead and get my clothing protector and place this over your chest so that way you don't get dirty and you don't get water on your clothing. Now I'm going to put my first set of gloves on. First set of gloves go on. And I'm going to get my toothpaste and toothbrush. I'm going to go ahead and put my toothbrush into the water so I wet the toothbrush. Take that out. Take this off, put my toothpaste on. Remember, for Headmaster, you're going to be working on a real patient, all right? Regional testing, it's going to be done on a mannequin, so that's going to be, the difference is going to be whatever your testing center is going to be, right? So this is going to be on a real patient. I'm going to ask you, Mr. Jones, can you go ahead and open your mouth so I can begin brushing your teeth? Wonderful. All right, I'm going to go brush his teeth. So I'm brushing all surfaces of his teeth, the upper and lower teeth, and including on his tongue. So can you open your mouth and stick out your tongue? Especially the tongue. I also need to clean the tongue. All right, very good. Looks like we've really brushed your teeth well. I'm going to go ahead and place this onto my barrier. I'm going to ask you if you can go ahead and open your mouth and go ahead and spit that out. And take another little swish. Swish it, and spit that out. And swish. And spit that out at least 2 times. If you want to go a third, that doesn't harm because you will be working on a real mannequin, a real person if you do Headmaster, so just be prepared for that. All right, very good. I can go ahead and place these articles right here. Now, I'm going to go ahead and take this aside. I want to go ahead and clean your mouth there for any excess. Very good. And I'll go ahead and roll this away. I'll take this. Right away, I could even do one thing. I might as well just do this now to reduce clutter, right? I could take this over to the soiled bin and place that in my soiled linen hamper, right? I can come back right here since we're still next to you, Mr. Jones. I'm going to go ahead and take care of all these items, but I just came in contact with some of your secretions, and for standard precautions, I don't want to touch your stuff with my gloves on. So I'm going to remove my first set of gloves and throw that in the trash, sanitize my hands. I'm going to be right back now. I'm going to get your bed so I can put you in a more comfortable position. I'm going to lower the bed to its lowest position since this bed is a crank bed. I can't adjust it the height, so I'm going to state that I'm bringing it to its lowest position for safety. And here's your call light. All right, so very good. What I'm going to do is get your stuff here, and I'm going to take it to the bathroom, okay, so I can discard of the contents in the MS's basin. All right, I'm going to put on my second pair of gloves. Second pair of gloves go on. I'm going to get whatever water is left over, not much in there, so I'm going to throw this whole container into the trash can. I can get the emesis basin, and I can get my barrier here. Take my barrier. I'm gonna take this right over to my sold bin and my linen hamper and place that inside my hamper. I'm walking into the bathroom now. So now that I'm in the bathroom, I'm gonna get my paper towel, because I'm gonna get a paper towel and place the paper towel onto the countertop so I can put my stuff on the barrier. This is my dirty side right here. I'm gonna get another paper towel, and this will be my cleaner side. This is my clean side. So once I've done with this, I'm gonna transfer it over to my clean side. All right, so I'm gonna start by getting my basin. I'm gonna get my paper towel, turn on the water. Water's on, I'm gonna rinse that out, and go ahead and rinse it out really well. All right, I'm gonna let that water run, so I'm gonna throw that paper towel in the trash, but now I'm gonna get more paper towels, and I'm gonna dry my basin. Dry the basin, place this onto my cleaner side, throw all those paper towels away. I'm gonna get my toothbrush, rinse the toothbrush. I'm not going to flick, or I'm not gonna tap, but I'm just going to rinse this and off, and I can get a paper towel just so I can, just to dry the excess water off the paper towel and throw that in the trash. Place this into its emesis basin, get my toothpaste, and rinse that off. And again, paper towel just to dry. I just like having dry stuff as much as I can into my basins. All right, so now I got water running. I got two barriers, my paper towel to turn off the water. I'm gonna get my barrier, throw that in the trash. I can even get a paper towel, because I'm gonna hold on to the paper towel. Let's just say I grabbed a paper towel, and just so I can, because I'm trying to keep this as clean as I can, right? I want this is sort of clean, right? So I'm gonna get my paper towel so I can take this over to its designated area. Put that aside. Does that cover that one, right? That was gonna cover that. So now I'm gonna get this, my barriers, throw those in the trash, since it's all paper towels, it can go right in the trash. Take off my set of gloves. States, sanitize his hands once I've thrown that in the trash. Sanitize his hands. So I really just need to go back into the room to do one thing, open a curtain for Mr. Jones, don't I? Hi, Mr. Jones. Just want to let you know everything's been done. I put your toothpaste and everything in its designated area. I'm gonna get your table here, so it's right there. So if you want your stuff on top of it, you let me know if you need anything. Call lights in reach. Your bed's low, so you're still safe. I'm gonna open up your curtains. I'm gonna wash my hands. The skill would be complete.